I'm so glad you're joining me today, either live or viewing the recording. A little about me. My name is Peggy Meyer. I am a wife, mother of 6 beautiful children, and you're looking at a photo of my family and my parents recently in Florida celebrating my parents' 50th wedding anniversary. My passion for health and wellness has been with me in some form since my childhood years. Sports was my thing throughout junior high, high school, and college. After getting married and having kids, other aspects of health, including getting enough quality sleep, reducing stress, eating better, and fitting in exercise, became very critical for me to be the best mom and the wife I could be. Throughout the years, I have often set goals to lose weight, eat healthier, and exercise more. Have any of you ever set a health or wellness related goal? Either for a New Year's resolution or around the holidays or summertime or even a special occasion or event? I have set numerous goals to lose 10 pounds. I have made plans to eat a salad for lunch, stop eating ice cream after supper, and getting up 30 minutes earlier to exercise. And it worked for a few days, sometimes even a week or two. Then life got in the way. A lunch meeting, a late ball game, a family get together, too much work left at the end of the day, and life stress happened. That was the end of the plan. So what do? Start again with a better plan and a health coach. Here's a little bit of background about me. I have my undergraduate in psychology, my master's in social work. I have 20 years experience as a mental health practitioner. I'm also a board certified coach, and I've taken trainings and certifications, including the Institute of Life Coach Training, Wellness Inventory, Circle of Life, Transformational Nutrition Coach. All of this means I just love to learn, and I love health and wellness, and I love to share what I learn with others. So what is the current healthcare landscape? Think about the last doctor visit you had. How much time did your doctor spend with you? Did you discuss health habits or nutrition or your lifestyle and activity levels? Generally, the answer is no. Most doctors only have a few minutes to spend with each client. Not that they don't want to spend more time with patients, they simply don't have enough time. Today's doctors are trained to focus on sickness, what I call sick care, putting a Band-Aid on the symptoms without figuring out the root cause of the issue or symptoms. Most conventional doctors aren't trained in the skill set of how to develop a long-term plan to keep you healthy and motivated while holding you accountable. Most of them have very little training in nutrition, but they tell you what you need to do: lose weight, eat better, and exercise. And it is up to you to figure it all out. Additionally, the landscape of healthcare has changed. Chronic disease now far outweighs acute illness. According to the CDC, as a nation, we spend 86% of our healthcare dollars on the treatment of chronic diseases. These persistent conditions, the nation's leading causes of death and disability, leave in their wake deaths that could have been prevented, lifelong disability, compromised quality of life, and skyrocketing healthcare costs. This is where health coaches can help. Many chronic diseases are preventable through diet and lifestyle changes. Health coaches have the time to support clients on an individual basis. So what does a healthcare coach do? The primary goal of a health coach is to help clients achieve their health goals. In other words, a health coach provides personalized care. Health coaches not only help clients work through lifestyle and behavior modifications, but they also mentor, inspire, guide, and motivate to cultivate positive health choices. When it comes to healthy eating, health coaches understand you already know what is healthy and what isn't. However, there are a lot more factors to consider, which is where a health coach can come in. Health coaches have the luxury of time that medical doctors don't have to delve deeper into the hows and whys of preventative care. Many doctor offices in larger communities are even starting to add health coaches to their staff. This is a huge win for patients. Health coaches provide guidance and management in the major components of health, including diet, physical activity, and overall wellness. In short, health coaching is a collaborative effort between the client and coach. Health coaching utilizes evidence-based clinical interventions, which incorporates a three-pronged approach: the best available research evidence bearing on whether a treatment works and why, expertise to identify a client's individual health state and risks, and client preferences and values. Some methods that health coaches use with clients include motivational interviewing, which is a client-centered counseling approach for eliciting behavior change by helping clients to identify strengths and weaknesses for meaningful change. Behavior change refers to efforts to address and change personal habits to prevent disease and achieve wellness. The trans-theoretical model is a means of assessing an individual's readiness to act on a new behavior and provide adequate strategies of change to guide the individual. Goal setting is a personal development tool used by health coaches to create an action plan designed to motivate and guide individuals towards a specific goal. Active listening is a communication technique used during sessions where a health coach fully concentrates on what an individual is communicating to establish an appropriate plan of action. Many coaches follow a health coaching model. So what is the client-coach process? First, it involves establishing a relationship. Building trust through rapport is essential for a successful coach-client relationship. The second step is motivational interview for building strong communication strategies. This step helps clients become aware of personal problems and limitations. The goal is to focus on the present and explore the individual's core values and goals. It is more important for clients to express a desire for change rather than being told change is necessary. The third step is creating a wellness vision. This can include physical, emotional, social, spiritual, and financial aspects of life. A wellness vision is used to help clients reach optimal well-being by connecting them to their own truth and wisdom that is held within. The fourth step is setting goals. The coach will help the client by acting as a guide through the goal-setting process. This is a collaborative step between client and coach. Setting appropriate goals is crucial when helping clients achieve wellness and success. The fifth step is the review and evaluation of goals. This is where the coach and client evaluates the progress of the goal and makes adjustments or modifications as needed to ensure a successful outcome. The final step is to maintain the goal. Once the goal is met, the coach will help the client to maintain the progress he or she has made. A healthy lifestyle is a journey, not a destination. It is a constant process of awareness, action, and evaluation. Your health coach is the perfect person to assist you in this journey. So what is the role of a health coach? Well, first, a health coach may not be a licensed dietitian. Many states require a separate license for prescribing specific diet plans, and I am not a licensed dietitian. Health coaches are also usually not medical advisors like doctors, PAs, or nurse practitioners who treat medical conditions or diseases. And health coaches, many are not licensed mental health therapists, although I do have the credentials. A health coach can help you understand the fundamentals of nutrition and recognize your eating habits. A health coach can provide many resources and suggestions for ways to reduce stress, exercise more, and get better quality sleep. A health coach can also assist in developing healthier relationships and create career goals. Why is health coaching so important? Health coaches are increasing in demand to help fill the gaps in traditional medicine. The future of healthcare is reshaping with the focus moving from treatment to prevention. Conventional medicine used to specialize in acute illnesses, chronic disease is now noted as being an epidemic today and taking up the majority of the healthcare time and money. Because acute and chronic diseases act differently in the body, traditional medicine simply cannot and does not have the necessary approaches in place. Fortunately, health coaches can help. The holistic care they provide is truly the future, treating the whole person, not just the symptoms. Health coaches focus on holistic care, making personal connections, smart goals, helping retrain the brain, promoting self-reliance, and establishing lifestyle habits. Health coaches have the unique ability to focus on holistic approach. Holistic health is defined as an integrated approach to healthcare that treats the whole person, not simply symptoms and disease. The concept is based on the idea that the human being is multidimensional. Therefore, health and wellness approaches need to consider the physical, emotional, social, and spiritual needs of the person to achieve optimal health. Health coaches do just that. Holistic health is something I have stressed with my clients for years. Health coaches work one-on-one with clients to focus on the emotional, physical, behavioral, nutritional, and lifestyle factors that are needed to enhance overall health and well-being. Another aspect often lacking in traditional healthcare settings is the established bond between the patient and the doctor. Health coaches work hard to provide genuine and meaningful interactions by building respect and trust with their client. Health coaches take the time to get to know clients in order to help set up and obtainable goals. By understanding the psychological, behavioral, and emotional needs of clients, a health coach can provide a truly personalized, client-centered experience. For example, by understanding lifestyle factors, someone who is too busy to cook a healthy meal every day, a health coach can provide alternatives and tips for healthy eating while taking into account a client's busy lifestyle. This could include simple meal prep ideas, healthy food swaps, and quick, easy, and nutritious recipes and meals. The goal is a positive change. Of course, this cannot happen without understanding what a client is and is not capable of doing. SMART goals. By understanding fitness style, personal interests, past successes and failures, health and fitness attitudes and beliefs, a health coach can work to establish attainable or achievable goals. Goals will be assessed as an ongoing process for both short and long-term objectives. A health coach will help you take vague ideas and aspirations and transform them into reality by setting SMART goals with you. Setting SMART goals provides structure and trackability to help clients be successful. They provide clear milestones and an estimation of attainability of each goal. SMART stands for specific, measurable, attainable or achievable, relevant or realistic, and time-bound. Your health coach will work with you to answer the following types of questions for setting your SMART objectives. What exactly do you want to achieve? Where? How? When? With whom? What are the conditions and limitations? Why exactly do you want to reach this goal? What are the possible alternative ways of achieving the same thing? Health coaches offer support in various ways. One specific technique is to help clients identify negative thinking patterns about themselves and their health to change how they look and feel. By identifying negative, irrational, and erroneous beliefs, health coaches help clients establish positive internal dialogue, otherwise known as self-talk. Retraining your brain to think more positively takes work, but is very effective. By shifting your focus on the positives rather than the negatives, your health outcomes change as well. For example, instead of saying, "I hate to exercise," remind yourself, "I feel great after I move my body." Over time, your brain will automatically shift to a more positive way of thinking without much effort. Change your mind, change your life. It's also important to understand we all have the power to be responsible for our own health. Traditional doctors are there to help treat your symptoms, but they can't prevent illness the way you can for yourself. Not even your health coach can do this for you. Your health coach wants to help you succeed and will be there for you every step of the way, but they can't do the work for you. Instead, a health coach gives you the tools and help you need to foster an environment for success. Being self-reliant will increase internal motivation and aid in the adoption of healthy habits. Developing healthy habits and being self-sufficient helps individuals maintain independence later in life as well as having energy to do all the things you want to do. Health coaches understand the need for people to feel empowered and can help provide the means for encouraging the very valuable confidence and growth everyone can benefit from. Healthy lifestyle habits can last a lifetime. The better you take care of yourself, the better you take care of others. And this reminds me of a recent airplane trip. Remember the oxygen mask rule? Place the mask over your mouth and nose first and secure tightly, then you assist others. Why? We can't help others if we have no oxygen. Take care of yourself first before you take care of others. How can you take care of yourself better? Health coaches enable individuals to see the value in reaching their health-related goals, as well as developing a meaningful connection between their lifestyle choices to experience a truly fulfilling life. Behaviors such as foods you eat, what you drink, the amount of sleep you get each night, and how physically active you are significantly impact your health and stress levels. Each of these behaviors can either positively or negatively affect your overall health in significant ways. Ultimately, a health coach will enable you to take ownership of your experience and create positive, lasting lifestyle change. When conventional medicine began, the aim was treating acute infectious diseases such as tuberculosis, typhoid, and pneumonia. Today, however, chronic disease attributes to 7 of 10 deaths in the U.S. Acute conditions are sudden and often severe and can include anything from a broken bone to an asthma attack. Chronic conditions, on the other hand, develop and worsen over an extended period of time. What are these chronic conditions? Heart disease tops the list, followed by cancer, chronic lower respiratory diseases, stroke, and diabetes. Many contributing factors to chronic diseases are preventable. For example, lifestyle influences such as diet and exercise. Fortunately, health coaches address both of these. The Center for Disease Control and Prevention reports that over a third of American adults are obese and another 25% of American adults are considered overweight. About 70% of the adult population is either overweight or obese. Among children and adolescents, 18% are considered obese, with no definite number of kids who are overweight. Obesity-related conditions include heart disease, stroke, type 2 diabetes, and certain types of cancer, some of the leading causes of preventable death. Some studies have shown health coaching to be effective in helping individuals lose and maintain weight, and in turn, lowering disease risk. Many even report increased confidence in weight loss when working with a health coach. Health coaches don't focus exclusively on things like calorie reduction or increasing physical activity. Rather, they teach the fundamentals of behavior modification and aid clients in overcoming the mental barriers that keep them from achieving their weight loss goals. The key to success is attributed to a health coach's ability to effectively encourage clients to make a permanent and positive changes in their lives by committing to living a healthier lifestyle today, tomorrow, and for the rest of their lives. The CDC reports about 610,000 people die of heart disease in the U.S. every year, which accounts for 1 in every 4 deaths. Furthermore, heart disease is the leading cause of death for both men and women. Risk factors for heart disease include high blood pressure, high cholesterol, and smoking. The sad truth is nearly 50% of Americans have at least one of these 3 risk factors. Other lifestyle factors can also put people at a higher risk for heart disease, including being overweight or obese, poor diet, lack of physical activity, excessive alcohol use, all of which can be improved and managed with the help of a health coach. Studies have shown patients in coaching programs achieve a significantly greater change in total cholesterol, as well as improvements in secondary outcomes such as weight loss, increased exercise, improved quality of life, less anxiety, and improvement in overall health and mood. Cancer is the number 2 cause of death in developed countries and number 1 in underdeveloped countries. Scientific experts worldwide agree that at least half of all cancers and cancer-related deaths are preventable, whereas only 5 to 10% of cancer cases have a genetic link. Cleaning up your diet, exercising, and regularly detoxifying are extremely important for achieving optimal health and reducing your risk of cancer. Surprisingly, sleep deprivation has also been linked to having a higher risk of cancer. When it comes to cancer, what you eat matters. The most common cancer-causing foods include refined sugar and flour, soda, microwave popcorn, food in cans produced with BPA, grilled or processed meat, and hydrogenated oils. The food choices you make every day can raise or lower your cancer risk, and a health coach can help you remove known offenders from your diet. The CDC reports chronic lower respiratory disease, also known as chronic obstructive pulmonary disease, or COPD, as the 3rd leading cause of death in the United States. While exposure to air pollutants in the home and workplace, genetic factors, and respiratory infections play a role, tobacco use is the key factor in the development and progression of chronic respiratory diseases. A number of studies have shown positive results with the interventions by health coaching as a tobacco cessation program. One study concluded a 32% quit rate among participants who received regular coaching. A health coach can help smokers get ready to quit, support smokers during the quitting process, and help smokers to stay smoke-free. Stroke is the 4th leading cause of death in the United States and the leading cause of serious long-term disability. Nearly 1/4 of strokes occur in people under the age of 65. Studies report many stroke survivors admit to feeling overwhelmed by the treatment recommended by their healthcare providers. Evidence shows that participation in programs that teach self-management skills and education can improve the quality of life and the self-efficacy after stroke, which is where a health coach can help significantly. Health coaching helps to enable individuals to improve and manage their stroke recovery with access to individual-centered and practical support when needed. Stroke prevention can also be achieved with the help of a health coach. The primary risk factor for stroke is hypertension or high blood pressure, which can be managed through diet and exercise. A health coach would recommend recipes low in salt, as well as ways to boost your fruit and vegetable intake. Other changes a health coach may recommend include limiting alcohol intake, regular physical activity, managing stress, maintaining a healthy weight, and quitting smoking. Several studies have shown health coaching to be effective in improving various aspects of type 2 diabetes. More specifically, it has been shown to have a positive effect on patients' knowledge, skill, self-efficacy, and behavior change regarding type 2 diabetes improvement. The CDC reports type 2 diabetes accounts for about 90 to 95% of all diagnosed cases of diabetes in adults, but it is largely preventable. 1 out of every 3 adults has prediabetes. However, 9 out of 10 of these people don't even know that they are pre-diabetic. Scientific risk factors include age, excess weight, particularly around the waist, family history, physical inactivity, and poor diet. Maintaining a healthy weight and regular physical activity are known to reduce the risk of type 2 diabetes significantly. The Diabetes Prevention Program found that weight loss and increased physical activity reduce the chance of prediabetes turning into type 2 diabetes by 58%. I want to thank you all for taking time to join me today. Being a health coach is something I am extremely passionate about. I love watching others while they achieve their goals and supporting them along the way. Here are a few references that were used in my presentation today. I hope by watching this presentation on why you need a health coach, you have thought of your own reasons you need a health coach. You only have one life to live. There is no better time than now to make steps to improve your health and your life. For your time and interest today, I am offering a free 30-minute consultation to explore where you are right now in your health and wellness, to assist you in narrowing your focus to 1 or 2 areas of most importance to you, and to help you decide what small step you can take right now to move you toward better health and wellness. Please email me at the address on the screen that you are interested in this free consultation, and I will contact you to set up a time for us to meet in person, via Zoom, or over the phone. Again, thank you for taking time out of your day to improve your health. I look forward to helping you achieve your health and wellness goals. Have a great day.